Every year, 30,000 hip replacements are performed in the Netherlands. Despite precautions, it's very hard to prevent bacterial contamination of these implants. For 300 patients, the body's natural defense is insufficient to kill these bacteria. This leads to infections, severe pain, and hospitalization. In such situations, it's often necessary to replace the implant. Revision surgery is invasive and complicated, and costs around €30 million annually. In the NANTICO project, researchers are working on dedicated antibacterial coatings for implants, such as protheses and catheters, that should protect against infection. Despite precautions and the use of sterile implant materials, bacteria can easily enter the surgical area and adhere to the surface of the implant. These bacteria then form a so-called biofilm, which protects them against both the immune system and antibiotics. As a result, the bone tissue gets infected, and eventually the implant may become loose and cause pain. In the NANTICO project, various types of coatings are being developed. As a first strategy, anti-adhesive coatings are developed, which prevent bacteria from binding to the surface of the implant. As a second strategy, biomaterials with antibacterial peptides are developed, which ensure that bacteria that do adhere to the surface of the implant are eliminated. Finally, coatings are being developed that release antimicrobial molecules, which kill bacteria that come into the vicinity of the surface. Application of these coatings in the clinic may lead to a lower risk of implant-associated infections. The coatings being developed within the NANTICO project are expected to halve the number of implant-associated infections in the future, preventing painful and sometimes life-threatening episodes for many people, and saving considerable healthcare costs.